The surgical complication with removal of tarsus palatinus, as we said before, fracture of the palatal process, nasal floor, perforation. This may be either due to hard or the strong manipulation without sectioning and a heavy stock on the chisel, or very thin palatal process from the beginning. And the nasal bleeding, result of deep cutting, make a groove and into the nasal cavity. These are the complications. Okay. And here's an examples of fractured tuberosity, fractured of the palatal during palatal tarsus palatinus removal. Here the nasal septum, of course, and here's the palate, part of the palate, and here's a removed is up to 2 millimeter, 2 centimeter length. Okay, we'll shift into the tarsus mandibullaris. As there's a bone exosus in the palate, there's a bone exosus in the mandible, which will interfere also with the stability of the lingual denture. Here, it will interfere with the lingual phalanges and make ulceration, of course. And here's it is indicated for removal. And here's another case of dentures, and this is with teeth here. And this interfere with in speech, and maybe ulcerated also, and lobulated torus mandibularis. How to remove it after the injection of the injection local anesthesia? Then we will start along the crest of the alveolar ridge incision, this here, from here to there, with bud buccal blade number 15. With the broad micropulse elevator, I have to reflect it in the buccal and in the lingual side. And it's better to put a piece of gauze between the metal part of the mucopus elevator and the area down. Okay? Then we make a trimming of the ridge, with the rotary instrument, suitable rotary instrument, rose head stone like this, but surgical. And then we close the two sides again and sutured, of course. Okay, there's another slide demonstration here for the torus mandibularis. The same procedures as we said before, and then the closure with continuous suture, or like here, or continuous suture lock. Okay. Okay. Then trimming of the buccal undercut. There's a way of trimming just to incise, make incision, vertical incision, and introduce the bone file from either sides, right and left, to make a shaving or a removal of this undercut. So by supple tunneling, it is a good way to be performed as in periprosthetic procedures. Here's again, there's a cross-section view of the posterior aspect of the mandible, showing concave contour of the superior aspect of the ridge from absorption. Of course, the ridge absorption here in the mandible. So we have to remove this undercut. This undercut along the is taken in consideration. So we have to make an incision on the case of the average, and using the longear as usual with the bone file. The longear bear can be used to remove the ear in the longear or bear طبعا surgical longear, or using rotary instruments as bear, and then the bone filing. All this with copies of saline irrigation. This slide is showing there's an undercut. Undercut can be treated with bone graft. Bone graft, when we are incision along the vertical incision, like we said before, and then we put a graft material just for the to return the normal alveolar ridge. As a matter of fact, one of disadvantage of this operation is the displacement of the grafted material, especially if it is alloplastic material. Okay.